Addiction coping strategies for successful recovery during the pandemic. We all know that addiction is a difficult disease to manage, but during periods of high COVID risk, it can be even more challenging. COVID results in a disruption to the individual's environment and lifestyle, which makes it harder for them to adapt and cope with their addiction. Additionally, during pandemics, there are usually shortages of resources such as treatment centers and rehabilitation specialists that can make caring for a person with substance use disorder more difficult. What are the effects of COVID on addiction? 1. Addiction becomes more difficult to manage during a pandemic. 2. Increase the risk of relapse. 3. Cause many to resort back to substance use as a coping mechanism for their stress and anxiety. 4. When one's environment changes during COVID and they lose their social support network because of it, there is a higher risk of relapse. What are the most effective coping strategies for successful recovery during a pandemic? There is no single perfect solution, but there are some techniques that work better than others. It can be helpful to talk about your addiction with friends or family members because they may have noticed certain patterns regarding when you use drugs or drink alcohol. Having someone to talk to is one of the most important coping strategies when it comes to addiction, so do not be afraid if you feel like talking about your addiction might make things worse. Consider taking up a new hobby or finding an outlet for stress relief. Physical activities such as running and biking are great ways of managing stress levels in high COVID risk periods. You need to be proactive in your actions and not reactive. If you wait for a crisis to occur before taking action, then you will be too late. Being proactive will help keep your mind clear and make it easier to resist urges from cravings as well as the stress associated with the pandemic. Remember that what works for one person may not work for another, so it's crucial to try out different coping strategies and techniques until you find something that is effective. If you can't think of anything on your own, then don't be afraid to ask others who are recovering from addictions about what they do when they are feeling stressed or overwhelmed. How does one prevent relapse during COVID? As we all know, addiction is a disease that causes individuals to become dependent on substances such as alcohol and illicit drugs. This dependence can result in both physical and psychological effects that make it difficult for one to live without these feelings of euphoria or relief from stress. The following are proven effective coping strategies that reduce stress and prevent relapse. Exercise at least 30 minutes, 4 to 5 times per week. Eating a healthy diet consisting of fresh fruits and vegetables daily. Meditating for 20 minutes twice per day or more if you feel stressed out due to COVID. Developing a social support system with friends and family to discuss your feelings or problems. Try finding opportunities for laughter, whether it be attending comedy shows or watching funny videos online. Summary. Not everybody is able to cope with COVID. It is important to seek medical help if you are unable to stop yourself from relapsing. It's important to continue developing coping skills for times of COVID. Always try to have a backup plan or people that one can call in case of cravings. This way addiction relapse can be prevented.